Thank you all for attending this evening. For those of you who don't know me, my name's Warwick and I am the Regional Sales Manager for Delio UK and Ireland. I'm kindly joined this evening by Dr. Galina, who will be talking about our Cristal Pro fat freezing device, why it's important for clinics, and how it can be combined with other treatments at your clinics. Dr. Galina, as you may know, works at Dr. Rita Race's clinic in Knightsbridge in London. And what I'm going to do, I'm going to leave room for questions at the end. But if you do have any questions as we go through the presentation, just put it in the chat and then we'll talk at the end. But if you want to wait till the end, that's fine. But before I hand over to Dr. Galina, I'm going to go through just a few slides, just a bit of a background about Delio, our business, just to give you an idea of how we're operating if you don't know much about us. So I'll start the presentation now. The agenda of the presentation, as I mentioned, I'm going to have a discussion just about the background of Delio. Then I'll hand over to Dr. Galina, who'll just go through the Cristal body layering program, how body is the new face, why cryolipolysis, why the Cristal Pro, and obviously how we combine that with other treatments as well at clinics. And then obviously Q&A at the end, go for any questions anyone has. Now, just a bit of a brief background about Delio. So Delio was established in 2010 in the south of France. The company's mission statement has been to produce high quality products for healthcare professionals and customers to achieve the best versions of themselves. As you can see there, we are certified under the below headings, so that we are approved and safe to work in the UK. And we are a leader in medical devices for aesthetic medicine with more than 800 installations worldwide and over 1 million treatments year to date. So we at Delio recognise to create a body layering range of devices targeting 3 layers of the body: dermis, the hypodermis and the muscle, to provide patients the ultimate body layer treatment experience. Our non-invasive treatments, as you can see here, are the Cristal Pro, which obviously we're going to discuss tonight, which crystallizes and destroys fat cells thanks to -12 degrees, which is the coldest on the market, 4 applicators to target multiple body areas, and built-in ultrasound technology for use for accurate diagnostics. Then we have the Cristal Fit, which uses electromagnetic muscle stimulation to sculpt, tone and shape muscles, which is achieved thanks to our 5 Tesla per applicator with higher and longer contractions to offer deep work on the entire muscle group. And lastly, we have the Cristal Skin, which is a radio multi-frequency module designed to firm up, tighten and reduce saggy skin, thanks to 2 radio frequencies to treat body and face at different depths. It's immediate heating and 3 sizes enable to reduce treatment time and accuracy. In addition to the body layering range, we have a light therapy range. This consists of the Origin laser, which is a microfractional erbium glass laser designed to treat skin laxity, scarring, stretch marks, wrinkles, and blepharoplasty. It does this thanks to the ultrafine laser beam of 70 microns for deeper and effective treatments. Also, a wavelength of 1550 nanometers is specific to activation of fibroblasts while limiting heat diffusion. We then have the LED Medisol, which is our phototherapy system with 4 wavelengths to treat scars, acne, stretch marks, alopecia, and burns. And lastly, we have the Sublime Hair Removal Laser, which is the fastest laser hair removal laser in the world at a speed of 10 Hertz. And then just to finish, we have worldwide distribution of our products. And there's a testimonial from a customer, Philip Klink in Switzerland, which really emphasizes the importance of combination treatments and the effectiveness of patient results, and how basically a standalone treatment is not enough. So I'll just read this really quick. So the concept brought customer satisfaction and trust. Patients feel more confident with their overall body shape and look and feel of their skin texture, laxity, cellulite. The combination of first treating with Pro for fat reduction and following skin and muscle tightening through Skin and Fit brought the most advanced results for a better overall body shape. So as you can see, it's not enough just to use one device, it's great to use all three to give the patient the most effective results possible. So what I'm going to do, I'm going to hand over to Dr. Galina now. So I will control the screen, Dr. Galina, and then I'm going to unmute you. So can you be able to unmute yourself? Yeah. So
Hello.
If you like, I'll go through and then I'll leave it to you to, I'll just click through and then you carry on speaking. Is that okay?
Yes, I can't see the presentation. And good evening, everyone. I also know a couple of people that I think have registered, but just texted me saying that they're a bit late. But it's very good that you are recording, because I think it would be quite good, not only for the professionals to see, but also for patients to see if they want to link. I think that's quite important to understand the concept of body layering for patients as well. But I can't see the presentation.
So let me just check something why you can't see. I'm not sure why you can't see.
Because I'm on my phone.
Let me just check something. Let me see if I can make you the host, so you might be able to see it. Actually, no, I'll take it away. I'm not sure. Can you see that? Can you see anything now?
No.
No, still not see.
I think I'm one of that very rare doctors that does not actually have a computer at home, because I try to leave work at home. But I should be able. I do majority of my Zooms here at work.
So if you we send you, Oshan send you the presentation now.
Yeah.
You have that and you can just go through. So Oshan, do you want to send Dr. Glenn the presentation?
Even if I don't have a presentation, I can talk about the concept. But what you can do is you can just direct me if I'm going somewhere in the right direction. So just keep me in line and I'll do the rest.
Right, so the first slide is, but why now? So the holistic version beauty is emerging.
Well, I see you. I think it's very important to address that devices in the aesthetic medicine are still somehow considered new, even though, and if you know, I work with Dr. Rita Rakers, who is the pioneer of majority of devices that we have launched in the UK. And one of the first devices actually was Thermage, and we are talking about 20 years ago. So it is interesting that still 20 years later, there are still professionals and there are still clinics and patients that have reservations. You have spoken very well about Delio. And what I want to say from my side is how long we have now worked with Delio. I would say about 4 or 5 years, I think on average, starting with the original Cristal. And now we have Cristal Pro, and I'm sure I can say it openly, we are waiting for the cellulite reduction device this week as well. So we are very excited about this. So we are expanding our Delio range. And I have to say, working with the company that supports you so well, and working with the company that puts the research and the innovation so highly is important. And as a professional and as a doctor performing the treatment, I have been incredibly happy, and that is important. Incredibly happy with my Delio machine. Now I'm going to talk about the concept, and this is my concept because everyone talks about the face. If you go to any of the conferences, they will all talk about rejuvenation of the face, and even not rejuvenation, beautification of the face. Changing the features of the face. You know what attracts the most audience? Nose jobs, liquid rhinoplasty. But the reality is that each and every face actually belongs to a human body. So if you think about percentages, the face represents, what is it? This is about 2% of our body. The face represents less than 5% of your entire of your body. Every other concern, your patient is either unaddressed because you don't have the means to address the concerns, or every single patient that you see for the face will most probably have the treatment elsewhere in the clinic where they provide the treatments. So body is an incredibly important element from an aesthetic medicine point of view. And now we are getting a little bit closer to the concept of body layering. And I think I absolutely love that you also have lasers, you have radio frequency devices, you have the electromagnetic stimulation devices, you have the fat freezing devices, which exactly represents pretty much all layers of the body, starting from the outer layer with the lasers and ablation, going into the depth further, which is skin tightening with radio frequency, going even further to the subcutaneous fat layer, and then ultimately achieving the muscle tone. So this layering concept, if you are addressing a professional, now we are aware that when you do facial rejuvenation, you are addressing multiple layers. We now know that even your bone structure changes with age. We know that fat pads change with age. We know that ligaments and muscles on the face, not only skin, but multiple layers should be addressed if you are to achieve ultimate rejuvenation. Same concept appears when it comes to body. And also, incredible rise of non-invasive treatments. And I'm sure Warwick will be able to provide you with statistics. It is actually represented in the presentation. I'm not going to go in depth now because I don't have the slides in front of me. But what we are seeing, and I have been doing body contouring treatments for the past 10 years, and what I am seeing now is the patients coming in, first of all, with knowledge that body contouring treatments exist. Secondly, they know they are effective because finally the technology, non-invasive technology, can provide you the answer, or not even a replacement, but let's say an alternative to liposuction. And even though liposuction is becoming, or has become over the years, less invasive, let's not forget it's still surgery. It is a minimum invasive surgery, but it is still surgery. And one of those surgeries that, even though gets rid of the volume of subcutaneous fat, does nothing to the skin or the muscle. So we're once again coming back to non-invasive treatments. So to have an alternative for surgical involvement makes me a much happier doctor, right? A much happier doctor, because I can tell my patient that this treatment exists. Yes, it is effective. It comes from a reputable producer, and it will provide you good results. And yes, I can address multiple concerns that you are presenting me, which usually when we come to body contouring is skin tightening, not only on the face, but on the body. Things like stretch marks, weight loss, pregnancy, aging, sun exposure. Every single aspect will result in the laxity of skin on the body. Then we have muscle tone. Muscle tone, again, we all came out of pandemic, and we all came out of, let's be very honest, very low activity levels. So now we are slowly going back into the gyms. We're slowly going back into actually looking after ourselves. And what we are seeing is that EMS, or electromagnetic stimulation, can greatly help it. And then, of course, subcutaneous fat layer. And this is when I see patients throughout the whole age ranges. I see younger girls that have stubborn, genetically predisposed fat, that they really affect their confidence in their body, and they have tried the healthy lifestyle, but they can't target them, so they want a little bit of help. Then I have patients, in their 30s and 40s, coming closer to menopause when it comes to women, for example, or patients after the menopause or perimenopausal period of their life, when even though they have healthy lifestyle, there is stubborn fat that starts to form on their body. And of course, while we treat quite a large percentage of male patients, and one of the reasons why male patients present more and more requesting body treatments is very interesting. Psychologically, I know that male patients trust technology. They understand that the technology can help you function during the day. It will help you get rid of your stubborn fat. Secondly, because we are now able to achieve good results with very minimum downtime. So most body contouring treatments are a lunchtime procedure, which means you pop into the clinic, you do the treatment, and you walk out and continue with your day, which is very important both for male and female patients. And of course, they're safe. And I always like to, I'm sure you know that's going to be one of the questions, and that is one of the questions that I welcome from my patients, and I discuss it openly and transparently, because not only, I'm not going to name any brands in particular here in view of transparency. I work with multiple brands and multiple agencies, and I am very transparent with my patients. Every single treatment has a degree of side effects. Every single treatment has a profile of, let's say, dangers and warning points that we want to talk and want to discuss with patients. But as a practitioner, as a doctor, what you do is you always try to reduce the side effects. So you try to increase your effectiveness and decrease the side effect profile. So having Delio as a addition to my body contouring range, and we, as I said, we swapped about from in the world of cryolipolysis, I think about 4 years ago that we started using Delio to great result, and it's much loved by the patients. But what I'm seeing is an incredible safety profile, and I'm going to talk about it specifically. But I just wanted to reassure Warwick, if you have any questions, please stop me and ask me the questions.
What I'm going to do, Doctor, I'm going to go through the slides.
Yeah.
And I'm just going to prompt you with what's on there, and then if you give us your kind of feedback. So I know we've just gone through body is the new face. You've kind of discussed that about, you know, how that is in the market at the moment. So question here is kind of like, you know, what's available. Obviously there's a laser, electromagnetic fields, but also cryolipolysis. So, you know, why kind of have you gone for cryolipolysis over the others?
Well, they are not mutually exclusive. You know, I think that's very important to say. When it comes to effectiveness, I'm going to be very honest with you, cryolipolysis still remains an incredibly effective. So some people call it gold standard. Some people say that it is the most effective way to get rid of stubborn fat. I say that the patient selection is incredibly important, and you will have your patient that needs more electromagnetic stimulation, or they will need more cryolipolysis. So I completely agree. Cryolipolysis is probably by far most effective and fastest way to get rid of the fat cells non-invasively, but combination treatments still are definitely my favorite.
Okay, no, good. So just on to the next slide. So, I mean, why would you say, I mean, it's got here, why is cryolipolysis still ahead of the game? Obviously with experience.
Because it works. It's as simple as I'm going to put it. It works. You have to know how to do it. You have to have the good machine, because I am fully aware, and as you can imagine, this being my specialty, I have done plenty of research, not only into the cryolipolysis as the umbrella body for the treatment, but also into each and every device. And we have tried a few. And there is a reason why I'm sticking to Delio. Is, first of all, that is my baby, by the way, on the background, going to sleep. So we're going to ignore that. If anything, just to reassure you, this is a real life situation, and it's not been rehearsed, and it's not been, you know, this is real life. So why you want to have a reputable company behind you? Because I want to, again, stress and stress again, it's not just cryolipolysis. You have to have a reputable company that produces the device to do the cryolipolysis. We know that cryolipolysis has been in the press, and you know, I always discuss that with my patient. I'm not going to say the famous model name again. I'm going to try to be very general here. But one of the most severe consequences or side effect, a known side effect of cryolipolysis that has been discussed since day one of cryolipolysis, all this, 12, 14 years ago. And I know because I'm trained in America, I actually trained cryolipolysis in the birth town, which is Pleasanton in California, of cryolipolysis. So it's been known since the early days that paradoxical hyperplasia, which means enlargement of fat cells, after, not immediately, but after performing cryolipolysis is a risk factor. However, the chances of developing it are so incredibly low. And I know some companies give you the percentage of 0.025. But with Delio, and I have reviewed the clinical papers behind, and I have looked into it and discussed it many times with Delio, and it is true, that risk, which is already, that numbers makes it a very rare side effect, even that is even further reduced to 0.006. So they are minimal. And I think that's very important. Secondly, when we deal with side effects, we want to make sure that our patient selection, and this is when your experience and your knowledge comes in, and I have performed thousands of treatments now, I think it's very important that there are certain criteria that you want from the device. And then there are certain criteria that you want to make sure that your patient represents. And with hyperplasia, I think the most affected, first of all, majority of the cases were reported with older machines and older applicators, where there was really tough suction. And when the treatment was performed, not necessarily on the patient who would be ideal for treatment. And that's usually male with a very hard, non-pinchable fat cells. So the amount of suction that needed to go in to almost isolate that what caused a lot of trauma, and then fibrosis and new vessel formation and fat cells. So that would be your kind of risk factor to consider. Older applicators, strong suction. Whereas with Delio, first of all, I have the settings that I, as an expert, can personalize according to my patient. And I think that's incredibly important, starting from the temperature, the suction, the applicator, the treatment time. I can personalize it depending on not only the patient that I treat, but also the area that I treat and the results that I want. If I am in any doubt, and this is what makes Delio so unique compared to any other cryolipolysis device, is the live ultrasound feed. I actually have the scanner. And if you know, ultrasound is now becoming a gold standard whenever it comes to safety. Whether you're doing fillers or whether you're doing treatment on the body, you want to know and you want to see what you are treating. So I actually have a live feedback from the ultrasound scanner that will allow me to say, A, is it fat? Is it treatable? What is the depth? What do I need to do? So I can have answers to my questions even before I started the assessment. And I think that's as part of my assessment. That is incredibly important from my safety perspective. Now, another thing is that there are features like gel pads. The company has thought through safety, and that is very important for me.
Okay. So I've just got a couple of things. Oh, Shannon, have we got any questions come through? So I can't see in the chat.
Not yet.
There's not any yet. Right. Okay.
Well, I just wanted to say, obviously, I understand that this is a webinar, but if any of the practitioners or patients want to come in to have a look, to shadow for a day, to see the machine in action, I'm very happy to do that in the clinic. And as you know, from a business perspective, Dr. Akers has been in business for 25 years. I've been part of the clinic for 10 years now. And what we have is multiple machines. So I think we have quite a few machines for both face and body, but we know how to combine the treatments. And I think I'm going to be leading again more and more the whole concept of combination treatments. And this is when Delio told me, obviously the founders, the representatives, I'm not going to go into names, but we had this incredible discussion with the team about body layering concept, and it's basically the future of body contouring. And I'll tell you why is it important from a perspective of a doctor. I am still, even if we work in the industry of beauty, we are still represent medicine, which means we have to consider the whole of patients, not only how they look or how their genes fit. So we have to consider the entire well-being. So the approach to aesthetic medicine should be holistic. And we, for example, at the clinic, we have a team working with us from the diet support. So we have a team of nutritionists working with us, and we refer to them. We have a team of personal trainers that we work with. We have biohacking. We have a number of external and internal ways. We have Prolon, which is a fasting mimicking diet. We have a number of supplements. We always approach a patient as a whole. Secondly, we work with combination treatment. And I can give you multiple reasons why combination treatments are better. But I'll give you a very simple reason. For example, circumference of a waist. Yeah, it's not only an aesthetic issue. It's not only about the size of the trousers or jeans or a dress that you wear that you want to go down in. It is actually a direct risk factor for coronary or basically heart disease, cardiovascular system. And it's interesting to know that it both happens in men and in women. So it's not only men that are risk factors for cardiovascular disease. Probably men are more talked about, but actually women have incredibly high risk of cardiovascular disease when it comes almost to the amount of visceral and subcutaneous fat that you are carrying around your waistline. So if we can reduce that risk, I am doing my doctor job. This is very important. I have patients in their 70s and 80s coming in for electromagnetic stimulation, which means muscle toning. Aesthetic result is probably the last thing on their mind. What they want is they want their gait. They want the posture stronger. I have young mothers or mothers, you don't have to be a young mother to need postpartum, let's say, I don't even want to call it rejuvenation or maintenance. You are a French company, in France, postpartum physiotherapy to address pelvic floor and diastase, which is the separation of the muscle, is actually part of mandatory treatment for a woman. In England, it is not. Nobody even discusses it. And the maximum that you're going to get is from a doctor or midwife to say, you have to work your muscles, do some Pilates. So this is where your electromagnetic stimulation of the muscle, what is it called, daily or feet, comes in, because it should almost be mandatory for any woman to tone their abdominal muscle. So there is no weakness afterwards. Again, so as the doctor, I am able to exercise medicine. Even though it is aesthetic medicine, it is still all about the well-being of the patient.
Dr. Glean, I've just got a question there. I know you mentioned about men. Do you treat many male patients
I do. I do. I have to say, we as a clinic, we have incredibly high percentage of male patients. And with the introduction of body contouring treatments, that has even increased. So I would say maybe about 25, 30% for overall treatments, and maybe 40% for body contouring treatments is represented by men. What we forget is, even though we don't talk in general population, I'm not talking about male magazines, you know, the JQ and all the kind of specific magazines that tell you that you have to train your body and how to build on muscles. It's good to say that, but male body or a man's body goes through same changes as a woman's body. So at a certain age, you are creatures of hormones in the same way, which means stubborn fat, usually flanks, abdomen, does appear. Breasts, male breast can enlarge. So there are still aspects of very resistant, stubborn fat. And it's not necessarily possible to lose few pounds. And also don't forget that you can have a grabbable fat on the flank without having extra pounds. It might be within your genetics. So all you're going to achieve, so you can't say, oh, you just lose some weight. That is actually the worst thing that you can say, because the person might not be overweight. And that is very important to understand. You cannot pinpoint with your finger onto your flank or a stubborn pocket of fat and say, okay, I'm going to lose 2 kilos, but actually, or 2 pounds, it's going to go just from here. Everything else is going to stay the same. So what happens is, with uncontrolled or unnecessary weight loss, you just start looking tired. You just start looking bony. Your muscle bulk can go, but your stubborn fat will stay. So a man do have stubborn fat, and every single rule of body contouring applies.
Okay. We actually did have a question, but you actually answered it. Was asking about how many kilos lost in weight after 3 to 4 sessions. Obviously, it's 30% fat loss, but I know you've kind of answered that already. So
first of all, this is a very common question. There are 2 very common questions. Number 1, how many kilos will I lose? Number 2, how many inches will I lose? And it is very important to address it directly. It is not a weight loss treatment. We do not aim at losing the kilos. The simple reason is, if you think about weight, fat is incredibly light, muscle is incredibly heavy. So if we are performing body contouring treatments to reduce the fat content, that would be light. There will be minimum changes. If we are working to bulk up or grow the muscle tone, you can even add on weight. It is called body contouring. It is not necessarily about weight loss. People come to me in healthy weight. We do not treat, or we rarely treat, overweight to the point of morbid obesity where weight does matter. And what we do, even if I treat it, I do it only in conjunction with healthy lifestyle, nutrition support, and sometimes doctors to address other aspects of, you know, I like to work with a GP to check the thyroid, to understand why there is such a, serious weight gain. So it is never a weight loss treatment. It is body contouring treatment. Now we're talking about inches. Let's say you have saddlebags, very common area to treat, incredibly common area to treat. There's actually no inches involved because the area is usually stubborn and round, almost pointy. So rather than athletic thigh, some women and men carry extra pockets of fat just where the buttocks ends. I am not interested in circumference here. I am interested in contouring their body. And I have to understand where and how to do it, not only as this area, but also in proportion with the rest of them. So if I am interested in only, let's say, inch loss, that I will not respect the body shape. I will not, I will not respect the rest of the body, because everything needs to be in proportion. The waist, the hip ratio, the chest ratio. If I'm only interested in the inch loss around their hips, I am losing the proportions. So inches, to think in inches and think in kilos is actually counterproductive. You need to think about the holistic approach, the other parts of the body, and make sure that it's all in proportion, and also the healthy lifestyle.
On that as well, Dr. Galina, I mean, what would you say a percentage of your patients come back for another treatment in another area?
A lot. I'll tell you. They come back, they bring their husbands, they bring their wives, they bring their mothers. I have a lovely patient who brought her. I'm very careful treating young girls in their early age, because I'm very wary of body dysmorphia, and I'm a psychiatrist in the past, and I have worked for 10 years in the field of psychiatry, in particular body dysmorphia. So I am always mindful of that. So I assess patients, but this particular patient was brought by her mother, who is a patient of mine, and it wasn't a stubborn fat pocket. It was actually a significant asymmetry. It was a significant asymmetry in the back fat that affected the girl, and she was young, she was in her early 20s, but she was so lacking confidence because of that a simple non-invasive safe treatment actually made a lot of change. So to answer your question from a different perspective, and I think that's also important, when you are doing consultation is key. And when I do my consultation, I ask my patients about million different things. Sometimes we talk about their mothers, sometimes we talk about their babies, but I also try to understand the mindset of the patient. I always like to have stage approaches. If the patient wants too many areas addressed at the same time, I try to pause and do it in stages, because the treatment, cryolipolysis, or even electromuscle stimulations, are incredibly motivating. So you will see natural weight loss from the changes in lifestyle during the treatment, and that's very important to keep in mind. But let's say if a patient had a successful abdominal treatment and now their tummy is flatter and they're happier with how it looks, they might not necessarily, their confidence boosts. So they might be happy. So it's good to stop there. Or they might see, okay, I see that, so maybe my bra fat needs to be addressed, and because I know it can be done. So it's a process. You want to take your patient on a journey. The percentage of, in my case, I do almost like body assessment. So I tell my patients what will achieve the best possible results. And sometimes they come in and they grab their flanks and they're like, oh, I just want that gone. And I talk them out of that, because again, that will break down the proportion of the rest of the body. The fact that the grabbable fat goes does not, you also lose the hourglass. So I might draw their attention that if we treat the abdomen and tighten the abdomen, that they will be happier with an overall look. So that comes with experience, but it also comes with a wish to achieve best possible results for your patients.
Great. And also, so you've got great patient satisfaction there at your clinic. Then sounds like. So
I love my patients. I love them.
Yeah, I've got another question. So just one that's come through on the chat now. Do you combine kind of invasive and non-invasive treatments for better results?
So I know, there is always a personal choice. There is always a degree of expertise, and there is always a patient selection. Over the years, my patient group are very non-invasive group, and they're very no downtime group. Even the lasers that I do, whether it is face or body, my patient will never do a CO2 laser because she cannot or he cannot, either a public figure and does not want the 1 week in, peeling and redness and topical antibiotics, or my patient is a lovely mummy who does not want to upset her child because her face is peeling. So somehow I have accumulated a philosophy that is based on the philosophy of my patients. So I like to be flexible there. I do know, and I travel around the world quite a lot, and I've done a lot of training in America and in Europe. So I do know that a number of plastic surgeons have Medispas attached to their clinics, so they combine non-invasive technology as a follow-up for their invasive treatments, in particularly skin tightening, because if you have plastic surgeons there, and they will agree that skin laxity after liposuction is always an issue, not sometimes, but always an issue. And you either address that invasively on the table while you perform liposuction with laser treatments or in more invasive treatments. Once again, I'm not going to name brands, but I'm sure there is a number of brands that provide minimum invasive skin tightening, or you then address it afterwards in the non-invasive department. I do have a number of plastic surgeons that I either refer to for invasive procedures if I think that I've reached a maximum and I cannot take the patient where they want to be. But I also have a number of plastic surgeons that refer to us for the follow-up from their procedures. So you can combine invasive and non-invasive, but again, the invasive procedures have high risk of side effects. So if you are somebody who works with non-invasive follow-up from an invasive procedure, you have to be very careful.
Great, thank you for that. So just a couple of more questions that I have as well for you, Dr. Galina. I mean, how many treatments, I mean, you've kind of gone through this, but like how many treatments are normally needed, and what is the treatment time and intervals in between?
Yeah, so I know, again, I think my experience is very international. So I do know some clinics that, actually not in the UK, but in Europe, they do retreatment straight after. So they do one treatment on the area and they double it. I am more cautious. I run a zero risk profile in a way, which means that anything that I perform, if it in any way increases the risks of a side effect, I'm not going to do it. So I tend to be on the cautious side, and I usually wait for about 6 weeks before retreatment. Why I do that? The patient might surprise you, and you might have amazing results and a happy patient from the first treatment. Secondly, the body will change. Treatment works. Cryolipolysis Cristal Pro works. Put it in your mind, which means that you can plan the second treatment, but you always need to allow time for the results to visualize. Otherwise, you're treating blindly. Treating blindly attracts side effects. And I am sure if you've done a bit of research, you have heard about shark bites, you have heard about indentation, you have heard about all those risks. The way you prevent those, and I have very little risk, is by waiting and being respectful towards the treatment. Do not forget also that no matter what treatment is, patient, once they've spent an hour with you, and I'm going to talk separately how amazing Cristal Pro is, and it's not a sales speech, it's actually reality. But once your patient have been with you for an hour, no matter what your pain threshold is, you are getting tired. Your body becomes sensitive. So you want to break that down. Maybe have 2 appointments of an hour each, rather than, squashing everything into that golden hour that you have with your patient. So why I love Cristal Pro, and Warwick very, very politely mentioned it. And my joke is it's a French machine, which means it's very elegant. There's very little pain. The reduction of temperature, the drop of the temperature is gradual, which means compared to some other brands, there isn't that intense pain for the first few minutes where patients go like, oh, no, get it off me. That is gone. But also you can treat, you have 4 applicators attached to the machine. So you can treat multiple areas simultaneously. And the treatment time, if you go to -20 and if you know what you're doing and feel comfortable going down to 30 minutes treatment protocol, it's a 30 minutes treatment. So within your hour, you can actually consult your patient, answer their questions, do the consent forms, do the photos, perform the treatment, and even give a cup of tea to your patient. And that's quite important because you have a happy patient leaving. So some doctors try to, some clinics also try to kind of have too many, too much. And that's when you invite in discomfort.
Great. I've got 2 questions here, but you've kind of already answered them. I mean,
I know, I'm a genius. I answer questions even before they come in.
Yes. It was just, how many sessions for the best results? And like you said, it's kind of just depends, and you've got to leave it a bit of time in between. It's dependent on the patient as well. And then there was, is -12 really necessary? Lots of benefits of going so cold. Is it not too traumatic for the patient? And like you said there,
it is only traumatic for the fat cells, not for the patient. And I think that's key. No, but I am being serious. We want to achieve trauma of the fat cells. We want them dead, which means we have to reach the point of apoptosis. We have to reach the point where they crystallize to the point, I use the word point a lot, that they have to reach a state, crystallized state, when they become debris of the fat cell. Not a fat cell. We don't shrink anything. We kill. That's how the results are permanent. And with healthy lifestyle, you won't need another fat treatment on the area. So what you want to achieve trauma. But the trauma is selective. It is only fat cells that dies, and it's very safe for the nerve endings. It's very safe for the muscle, for the skin, so you are not causing damage there. And that's very important. We want trauma. We want dead fat cells, but it's not traumatic for the patient. If you are to keep the temperature at -9, and I can think of a few clinical scenarios where you would keep the temperature at -9, you might need to repeat your treatment because not percentage of fat cells that will crystallize might be lower. But that's, again, you are going into more advanced setting. And that's another point about Cristal Pro. You don't need to change the settings. There are pre-recorded protocols. So it can be as simple, press the button and follow the instructions of the machine if you are starting in the industry. So that can be very, very easy because it is literally a very careful press the button. If you are getting to the point where you already have experience, then you can do tweaks.
So is there a lot that combining treatment that works? So what do you combine a lot with fat freezing, would you say?
The combination should work, based on the patient. So depending on what and who is in front of you. And 2, you have to still remember you're a doctor. So you have to gather medical history. I have a patient with significant lymphatic crisis, and her retained water is her number one concern. For me to perform a cryolipolysis treatment that will only crystallize the fat cells, her lymphatic system will not be able to metabolize the debris. So I first needed to boost her lymphatic system, which means lymphatic drainage. And I use endospheres at clinic for that. So we really boost lymphatic drainage, perform the cryolipolysis, and boost the lymphatic drainage afterwards. And that will give me real results. When it comes to Delio range, I just said that we're having the new cellulite machine, and that is incredibly important for areas like saddleback, because most commonly patients present not only with stubborn pockets of fat, but also with stubborn cellulite. So I do combination with that, and I just wait a couple of weeks just to subside for the inflammation. I want the inflammation. It's a good, clean inflammation. And then let's say polish off the surface, especially the buttocks and the back of the legs with a cellulite reduction machine. And when I have, let's say, a young mother, again, I'm a young mother and I'm 42 in 2 months, and there's my baby sleeping next room. But for me, it was also important to add on radio frequency into my combination and muscle stimulation, because again, my own abdomen just expanded and I need to bring it back. So that I have to do on multiple levels. Address the muscle, starting with pelvic floor, don't forget that. Address the muscle, abdominal recti, to prevent diastasis. Even if you don't have a full separation, you still want to tone it. Cut down on the layer of the subcutaneous fat cells, and most importantly, tighten the skin with radio frequency.
Perfect. Now, just with regards to the Cristal Pro, so those people probably don't know everything about the running costs of it. Do you have any running costs with the Cristal Pro?
Wow. So I think it's quite important, once again, because I'm very transparent about running costs. There are more to running costs than just cost of disposables. It is the talent you have in clinic. It is the energy. It is the electricity. It is the rent you pay. It is so. From a business perspective, there is a lot that goes into running a treatment, right? But from perspective of disposables that are there for Cristal Pro, that are by far the most friendliest in the world of other disposables. And that's how I'm going to leave it. Warwick and Saskia will be able to give you the monetary points of it. But so again, there are other costs to run in a clinic, and I'm sure that your providers and fellow doctors, they understand that. But when it comes to disposables and cost per treatment, very happy.
Yeah, it's just the pads. We don't charge for usage of the unit like some of the devices. Fat-free devices have to pay to use the device. We don't obviously do that. It's just the pads that obviously said of the cost of your team and everything along that. So just a couple of other questions. We've not got long left now, Dr. Gleaner, is just about you guys at the clinic. I mean, how would you tell me that? How would you market? How would you market the devices at your clinic, the Cristal Pro device? How I would market? Yeah, do you have a social media strategy or internally?
So first of all, you are the best marketing tool. You need to have the treatment yourself. And only then will you understand, would your patient group agree for that? And would they be up for it or not? Because your patient group respects you. They trust you with their injectable on their face. They trust you with their, I don't know, dental work. They trust you with their, oh God, what are you doing? Which means you have to try the treatment itself. And then you will be the best marketing. I have had Delio, I have had pretty much, well, actually, I have had every single treatment I do, because that's the only way I know if I like it, if it works, if it's effective, can I take it? And that's quite important. even before you get to the point of business numbers. So number one, have the treatment yourself. Number two, make sure your team is aware that this is a new device that you have in the clinic. So treat your team and let them talk to your patients, your reception room, your front, your ambassadors. Give them that treatment as a trial, because you want their feedback, and also you're going to get better as a practitioner while you have more exposure. Of course, Delio does quite good job as a company, and don't forget, the device is only as good as the company behind it. So Delio does quite good job. They're always present in the conferences. They're always present in all the congresses. Every single congress this year, I have seen there with big booths, really smiley faces. They are there at the end of the phone. So they do quite a good job. No, it's not a compliment, it's reality. Well, take it as a compliment, but it's reality. Because you want a good support, not only from your sales rep, but also from medical team within the company. And they have been very, very fast in responding. Secondly, of course, depending which means, if you're an Instagram person, you can do it on Instagram. If you're a Facebook person, you can do it on Facebook. If you're the TikTok generation, please do. So yes, social media is quite important. Of course, I'm not going to go into the depths of search engine optimization and things like that, but I'm going to tell you one thing. Your patient group is already ahead of you. They're actively searching for body treatments. They are actively searching for answers for their body concerns. So from your side, it's always neglect if you are not providing the answers.
Perfect. I'm going to squeeze in one final question. So what's been the financial gain to you at the clinic for using the fat freezing device? What would you say? Has it gone up? Have you had more interest?
Oh, yeah. Over the years, it's been multi-million affair. So let's not go around bushes. It is a very highly regarded from a business perspective. So it's a multi-million operation. Let's put it this way.
Perfect.
I don't like numbers. I'm a doctor.
Okay.
But from a business perspective, it is a very solid investment from a clinic.
Perfect.
And your returns will be fast. Of course, if you're good.
Well, as I say, it's 4 applicators, as we said, so you can treat multiple areas. You can charge, obviously, for 4 areas at a time. So your return on investment will be a lot faster than if it was with 2 or 1. So, right, well, I'll tell you what, we'll finish there because we're coming to the end, Dr.
Once again, my offer stands. If anyone wants to approach me directly, please do. I'm very happy to share off protocol and off record personal experience, and I'm a great fan. So never once have we regretted almost doing the transition to Delio.
Perfect. Well, we really appreciate that. If anyone is interested, just reach out to me, and then I can get in touch with Dr. Galina and we can facilitate something. So appreciate it. I'm sharing all your experiences with using the Cristal Pro Fat Freezing device. Really appreciate it. And yeah, thank you for everyone who's joined this evening as well. It is recorded, so I'll share the recording afterwards. And any questions, please reach out to me. I think, is there one more question? I'm just going to quickly check because oh no, that was all of them. You've done them all, Dr. Galina. So thank you very much, and I appreciate everyone's time tonight.
Thank you so much for your time, everyone.
Take care.